getting a few more people in. Participants are still coming in, so please do come in, keep yourself muted so that we can hear our panelists, so that we can have a very constructive conversation. Those of you who are joining us now, do keep your phones on silent and your microphones muted so that we can really learn as much as we can from each other and glean as much as we can from our panelists. So here's the thing. I want us to have a very frank discussion that takes into account not just the science, but how people really feel. That helps us reckon with how this pandemic has affected our lives, has affected our work. And I also want us to acknowledge that this has been a period of profound loss for so many of us. So we approach this vaccine literacy and core preventative behaviors webinar with that in mind, a desire to be frank, to be authentic, to keep each other intact, but most importantly, to keep each other informed. I'm your moderator, Ridi Klabi, and thank you for the honor of speaking to you this evening. So here's the thing. For me personally, I was raised by a nurse. I believe in vaccines. I believe that they work. I affirm and amplify that message. But at the same time, I want to respect someone who's skeptical, someone who's afraid, someone who's not sure, someone who's got questions around why was this vaccine developed so quickly? What are the side effects? What if I've got comorbidities? How does it interact with every other medication that I take at the moment? Okay. And also the side effects. Are they more important than the protection that the vaccine provides? What if someone has some cultural aversion to vaccines? Can we address that with honesty and empathy? What I'm trying to avoid in this conversation to the participants and those who will be tweeting is for us to be dismissive of each other. I've learned in the last couple of months that there are people who are not anti-vaxxers, who are not into whataboutism, but they are genuinely anxious, they are genuinely scared, they are genuinely inquisitive. And I think we should encourage that and welcome it. So even as Ridi Klabi herself asserts that vaccines work, I want to respect people who have questions. The second thing that I want us to be very, very honest about is that this is not a PR exercise. I don't do PR, I don't do public relations, and neither do members of my esteemed panel. These are healthcare workers, these are scientists who are saving lives, who are using their expertise and their emotional capital to respond to the magnitude of this moment. I guarantee you that not a single one of these people here tonight who have gifted us with their time are interested in a public relations exercise. And so, because this is not a public relations exercise, there are just a few things that I want to acknowledge and express. The first thing is that we are way below target as South Africa when it comes to vaccines. That's no debate. It is true. The second thing that has been absolutely exasperating for me is that we are in the middle of a pandemic and we have an acting health minister. That is hardly an ideal situation. The third thing I want to acknowledge is that resources have not always gone to where they're supposed to go. We saw yesterday the Auditor General telling us how many billions of rands have fallen through the cracks. This is money that would have been most crucial in responding to this moment today, or to this moment in which we find ourselves. We know that healthcare infrastructure has been neglected. We see fires breaking out in some hospitals. We know that some hospitals have done without water. But the one I think that should weigh heavily on any right-thinking South African is the inequality in our country, is the living conditions of many of our people, the call for them to social distance when circumstances don't allow for them to social distance, the call for them to keep some distance apart when they have to travel in taxis to be at their places of work, the call for people to wash their hands and sanitize where they don't even have money to put food on the table. Those are our realities and we ought to acknowledge them. But having said all of that, even with these weighty and pressing matters, vaccines do work. They present the best hope for us to get out of this pandemic. What else works? Unity in action. Again, not a PR exercise. You can interpret the statement or the slogan whichever way you wish to interpret it. I'm not going to dictate to you. This is how I interpret it. I'm not saying we should now be in a kumbaya type of love affair with each other. My interpretation of unity in action, which is what Solidarity Fund is enjoining us to declare. For me, what it means is my well-being depends on your well-being, and your well-being depends on mine. If I'm not feeling well, I shouldn't force myself and go to public places and expose my family, my community, my neighbors to me. I need to protect them. That's unity. What it means is that I wear a mask to protect you. You wear a mask to protect me. Unity in action also means that we are honest. When anybody in our family, or if we ourselves are showing symptoms, we inform our schools, we inform the people that we're interacting with. We speak openly so that people can be armed with knowledge and information that protects them. That's how me, Redi Tlhabi, interprets unity in action. You can make of it what you want. So welcome, ladies and gentlemen, to the vaccine literacy and core preventative behaviors. My guests today, Dr. Sangla Rosani, an independent medical expert whose column I've been really enjoying in the Daily Dispatch, and I know that you've made some media commentary as well, Dr. Sangla, around COVID and health in general. So welcome to you. It's a joy also to welcome Dr. Saul Johnson, who's the advisor at Solidarity Fund, also a medical expert. Welcome to you, Dr. Johnson. And I know that we're having some problems with our representative from DENOSA, which is a nurses union, Mr. Simpiwe Gada. But as soon as we have connected with you, I hope we can welcome you as well. Let me welcome also Dr. Boitumelo Semete Makokotlela, Chief Executive Officer of SAPRA. These are the people who approve vaccines. These are the people who decide what vaccines are available for us as South Africans. But it's not simple. There's a process here. I don't think Dr. Boitumelo just sits and decides, I'm going to give them this vaccine and not that vaccine. So she will tell us about that. Okay, so we've got the chat box. If you've got questions, just send them through. We can't ask everything. We absolutely cannot. Those of you who want to tweet me, do tweet me at Redi Tlhabi and use hashtag Unity in Action. Any question you have, we are going to answer it today. Dr. Sangla, let me start with you. I'm going to pick on you this evening. What is your sense of how we are responding to COVID-19 as South Africans? There was goodwill when we first began this journey last year. My sense is that people are getting tired, but sadly, we can't afford to get tired. What is your assessment? How do you measure the mood and the position in which we find ourselves as a country?
Good evening, Redi, and thank you for that introduction. I liked your opening remarks, and I think we could just close our computers and go home now because you've covered most of the things. And I would also like to state categorically that I can see my iPad, all my gadgets are around me, so nothing is missing.
Except 10 babies, but anyway.
Now, I like your question because around this time last year, we were discussing the first wave. We are now in the third wave. And when the pandemic started, South Africa responded late. We made the call and we were told that we were being some names that were used about scaremongering and all of that when we were saying, close, do something, take action. And nothing happened. But when we started, the communication from the minister was excellent. You could see he was comfortable in the space. He spoke the language, and it was easy to understand. We were 3 months behind the United Kingdom at the time. With COVID, unfortunately, it is something new. So things started evolving and changing as we're going along. The main thing I feel that South Africa has lacked then and is still lacking now is testing capacity. Initially, it was symptomatic people, and then the Republic of Western Cape went with 55 years old and comorbidities, and then they kept changing it around. But you cannot get around the fact that with this condition, you need to test. test, and test. I'll give you an example now. Yesterday, I think South Africa did about 35 to 40,000, around the 40,000 mark of tests. The United Kingdom did well over 1 million. But the numbers of positive cases are almost the same. The deaths in South Africa are in the hundreds. The deaths here up until 2 days ago were in single digits. Now, that's the one thing. You've spoken about self-isolation, washing, and all the things that are needed. We've seen in New Zealand, they are now, you could say they're out of whatever we're going through at the same time. You've seen in the United States, when Joe Biden took over, they started paying people. Here, the furlough system was approved immediately for workers, and then self-employed people complained and it was approved for them. So the governments were actually paying people to do what they asked them of to, which is stay at home. Working at home. Today, again, I saw that in the Eastern Cape, there's 1,000 schools that have still not been connected to broadband, meaning that online learning and all the gadgets that are needed cannot happen. So we have got so many impediments as a country in terms of dealing with this pandemic. And most of them, unfortunately, are financial. And the money, I've been told when I'm having discussions with people, because some of us will say there's no money. Other people say, no, there is money. It is being misspent. You've mentioned the Auditor General. I looked at those billions, and immediately my mind says, how many tests could be increased capacity, testing capacity? How many more vaccines can be procured with that money? So it is a matter of how the resources are being used. And the unfortunate thing, as you've mentioned already, is the people on the ground that are suffering. Because if you say stay at home, do all these things, the next question is, how am I going to feed my family? So now we find ourselves in a very, very delicate, difficult situation as a country, South Africa, that is, because we are now fighting a third wave. You've already said it, vaccines are scarce at the moment, and the rest of the world is opening up. Today, the economy of the UK increased, even though they've paid billions in furlough scheme. But this year, they're saying because the economy is opening up, things are starting to move. 60,000 people will be at Wembley watching the Euros. You've seen on TV watching all the sporting events and everything. The rest of the world is moving along. Yeah. We have got a situation called Gauteng at the moment. Now, the Gauteng situation is going to spill over to the rest of the country. And when we say monitor yourself, watch your oxygen level, when it drops less than 92, go to hospital. At the moment, doctors are dealing with critical patients. They are not going to be able to manage you.
In fact, that's really, really scary, because I saw a news report. Initially, I thought it was fake news. Somebody was sending WhatsApps all over the show that doctors were treating patients in cars, until I saw a news report. So that was actually legitimized. We're hearing every single day that our hospitals are full and that the situation is so dire. Dr. Johnson, let me bring you in here, if you can unmute your microphone. Perhaps we are wading into political matters, but the fact of the matter is that someone has to treat those patients. Someone has to respond to the call. Should we be in lockdown level 5 in the country from a health point of view? What do you think?
You know, this is such a difficult question to answer, really, for you know, all the reasons we've discussed already. That we have such an impossible juggling act to decide between. We know that if we stop people from interacting with each other, we will stop the virus from spreading. That is just the fact. That is the one thing that has really worked all over the world. If you stop people from socializing, from getting together, whether that be socially or at work, you stop the virus from spreading, and you know, you calm down your epidemic. But at the same time, as we said, that means that that people, you restrict economic activity, and that's so hard to do in a very, very fragile economy like South Africa. I would say we haven't gone far enough. I think we, certainly in Gauteng, we really need to be quicker and nimbler about certainly closing indoor gatherings, stopping people getting together as far as we can, because we really have to stop these super spreader events. That's how this virus spreads. It spreads where people get together in family gatherings, unfortunately at religious gatherings. That's, I think we saw that preceding this third wave. It'll continue to happen. So I'm afraid I think we have to do it at this stage. We have to lock down more. Whether we call it level 4 or 5, I don't know, but we certainly have to put more restrictions on social gatherings, no question in my mind.
I'm going to come to Dr. Boitumelo in just a moment, but Dr. Johnson, while I still have you, we've got a comment from Lesego who says, I still think there's a gap in terms of education around vaccines. I think this can help a lot. That's why we're here. We're going to do that in a moment. But she says, also in South Africa, we are generally pro-lawlessness. Look at the many political leaders who have violated COVID-19 protocols. So in my view, two things need to be intensified: education, accountability, and action. We'll get to the vaccine matter in a moment, Dr. Johnson, but I don't know, Doc, you know, I looked at Solidarity Fund's research. I mean, Solidarity has been out there. It's not just a fund, but there's a lot of education, a lot of surveys, and some scientific research and so on, that the level of compliance generally was high initially. Has that changed? And if it has, at some level, it is understandable that people despair. You do the right thing for a while, and then you read that your leaders are not doing the right thing. The vaccines are not coming. The jobs are being lost, all of that. So I guess what I'm getting at is for you to comment on the extent or the level of compliance, but also, is it fair to ask people to continue to comply when things that they can't control at a structural level, budget level, vaccine levels are not being done? What are your thoughts?
I think South Africans have actually been quite remarkable. I think people really have done what they were asked to do. So I think certainly up till now, people have generally been fairly compliant. And if we look at attitudes towards things like wearing masks, good ventilation, people's attitudes are pretty positive around that. I think people are tired. We are social beings. We like to interact with each other. It's been a long haul. I think people are tired. But you need to get the right signals from government. I think government need to be clear in what we're asking people to do. And then leaders need to follow that. So I think that's really important, that we put out a message saying we're going into a third wave. The only way is for people to be really disciplined about their behavior. And then everybody has to follow that. Ready, you're on mute.
Yes. Now that we have Simpiwe Gada from Denosa, perhaps you can come in here, Simpiwe. I mean, you represent Denosa, a nurses union. I want to find out from you. Take me inside that ward on a typical day of losses and tears and being under pressure and health workers being overwhelmed. Share that with me, just a snippet of what goes on when a COVID ward is packed and you really have to fire on all cylinders. But also in answering that, my last question to Dr. Johnson, and something that Dr. Rosani mentioned, do you want to see a lockdown? Would a total lockdown help you as nurses, as frontline workers? What do you say? Simpiwe? Okay, I can see Simpiwe is here. Okay, we'll come back to Simpiwe in just a moment. Simpiwe, just indicate to me when you are ready to speak to us, and then we can invite you back into the conversation. But okay, let's just go to Dr. Boitumelo Semete. Dr. Boitumelo, you are seen as people who hold the key. You decide whether we get vaccines or not, or maybe not. How does this process work? Why is it so complicated? Why do you have to tick every single box, dot every T and dot, or cross every T and dot every I before you give us vaccines?
Thanks. That's a good question. And I mean, this is a process that we apply for medicines and health products in general. But I think what COVID has done it has brought the regulator to the spotlight. So, you know, typically when you take paracetamol, you never think that there's a lot of work that's gone behind ensuring that the labeling on the package is correct. There's work that's gone into ensuring that when you do purchase it, if it says it's paracetamol, it is paracetamol and it's not anything else. So, COVID has really done that. And that's the benefit of that we've seen in all of this, that there's an opportunity for us to educate the public on what we do as regulators. And if I can maybe just speak directly to your question, there's three things that we look at when we look at vaccines and health products in general. We look at, are they safe, right? So when you consume this product as a person in South Africa, because all regulators have a jurisdictive mandate. So when you're in South Africa, you take this product, is it safe? And if it has any side effects, are those side effects communicated to you? Those pamphlets that you get in the box when you purchase, it will tell you what are the contraindications. So what medication you're not supposed to take it with, what are the side effects you will feel, so that you know. So we look at that. We also say, is it effective? So if it says it, in the case of vaccines, they would either say that it reduces, mild or severe disease. What we know is that these vaccines do not prevent you from getting infected. You will be infected. However, it will minimize the severity of the disease, because what it does is it helps your body to fight the vaccine. So it basically supplements your own body's mechanism to fight the vaccine. So we look at that, and there is a threshold that all of these vaccines must meet. So some of you may have heard that, the mRNA vaccines have got about a 90 or so vaccine efficacy against the original wild type strain. But very important for us is to say, how effective is it against the beta variant that is the most dominant in South Africa at the moment? There is studies that are happening to see the level of the Delta variant, and we will need to, as a regulator, get that data. So we want to be sure that when someone receives that jab, there is an efficacy level that meets a regulatory requirement. So we can say, you may get the disease, but the severity would not be strong. The last thing that we look at is quality. We say, is it manufactured in a facility that complies with good manufacturing process? When it arrives in South Africa, because a lot of these, pretty much all of them, are not manufactured locally. In the case of the Janssen vaccine, the active pharmaceutical is manufactured overseas. And then Aspen, they would do what we call the fill and finish, so make the formulation. So we need to make sure that when it's here, it is a quality product, right? And the minute we get information or data that says it's not a quality product, and that's why we put a pause initially on those doses at Aspen. And when we got the data that when these were manufactured at the facility, which was non-compliant, we then immediately said they cannot be released as soon as we got data from the FDA. And so those are the three key elements that we look at. With COVID, we had to be cognizant of the fact that we're operating in a pandemic. We're not going to have all the perfect data that we would typically want. And so, we've put in mechanisms of expediting. I mean, my team is working throughout the clock. We don't know a public holiday as SAPRA. We're really working throughout the clock. We've instituted mechanisms that as applicants get data, make it available. Don't wait for your full package of data. But also what we've done is applied what we call benefit risk assessment. And, to the point you made earlier, to say people are asking themselves, but these vaccines were manufactured so quickly, typically take years. Why now are they available now? So we've done a benefit risk assessment, and it's not an easy exercise to do. There's many things that we consider there. So it's not a process that takes, days or sometimes even weeks. It could take months because we have to get, all the experts. You must see how big our meetings are. We get all the experts someone who will come and talk to safety, someone who will come and talk to the efficacy. We get clinicians, we get virologists into the discussions to come and advise us and advise me, because I don't know it all. And so that's really the process that we go through.
Okay. While I still have you here, and Dr. Sangwa, I'm coming to you in just a moment. I just want to address something here. We have relationships with certain countries. There are geopolitics at play. And I've often seen on social media people saying, why don't you take the vaccine from Cuba, from Russia, from China, because those are our friends. I imagine from a science point of view, a scientific point of view, it does not quite work that way. Just for background, we don't have the Moderna vaccine from the US and Sinopharm from China because those companies have not applied with you, the regulator, for authorization use. Let's go to Russia, our friends, also I hear. Sinovac and Sputnik have applied. Why have you not approved them?
Sure. And also, you will see there's a press statement that is probably out as we speak.
Yes.
We just received an application for Sinopharm. So we will then start to review that. So the ones we don't have are Moderna and Novavax, which are some of the ones that have World Health Organization emergency use listing. So we now have Sinopharm. Okay. We've received Sinovac and we received an application also for the Sputnik vaccine. And the reason why there hasn't been a decision on them is because we're still in the process of the review. I mean, we engage with the applicants on a weekly basis, in some instances every other day. We have meetings with them late into the night. One of the applicants, we had a meeting with them, last week, Wednesday, on a public holiday, because we want to ensure that we get the data that we require. Again, these are not decisions that we make in days or weeks. It's voluminous sets of data that we look at. If I can make an example with the Janssen vaccine, they first applied to us in November of last year. We made the decision end of March of this year. And it's because we needed to ensure that the data that we need is made available. And so, we want to assure the public that as much as we're taking what seems to be so long, I mean, typically our timelines are a lot longer. What seems to be long is because we are applying rigor in assessing the information that's been made available to us.
Okay. And I think Dr. Vitumelo is being diplomatic. So I'm just going to say it for our audience that, we are in a situation where the approval process is perhaps delayed or even complicated by the fact that we've got this beta variant that's dominant in South Africa. They've got to assure themselves that the vaccines that they approve do respond to that and do offer immunity. And you can contradict me if I'm wrong, Dr. Vitumelo, but I read something as well with Sputnik that the type of adenovirus it uses is similar to one used in an HIV vaccine trial that was stopped early because there was data which suggested that it led to an increased risk of HIV infection amongst uncircumcised men. I think this information is important to get out there so that people don't sit and think that you're sitting there thinking, Piki Mabelani Sala, it's not that process, right? Dr. Sangla, I want to bring in the science, the politics, the frustration, and so on. I went on a vaccine registration roadshow amongst elderly people whom I love, and I was determined to register them. I played by the rules. I was determined to wait for those SMSs, but all around me, I just heard stories of people getting vaccines without waiting for the SMS, and this one got it, this one didn't, this one didn't. And it was only when I interacted with some doctors, even some who are strangers to me, but I know them on social media, who had a debate around ethics, around playing by the rules is important, but there's a pandemic. If the person qualifies because of age and comorbidities and so on, just take them for the vaccine. That cleared my conscience. I did it. But as a medical worker, as a doctor yourself, and I know you respect rules, Dr. Sangla, are we doing this the right way? And by this, I mean the technological infrastructure, but also going in terms of categories for qualification. I ask this, Dr. Sangla, because I'm watching and I'm seeing people getting incentivized to take the vaccine. There's a lotto here, there are tickets to this thing. And then some people are getting vaccines at shopping centers. They're told you don't need an appointment anymore and so on. Why are we not giving vaccines to people who also want them? Because even amongst those who qualify, there are those who don't want them. Is it right for us to be going 60, 50, teachers, da-da-da? Or should we just open it up so people can get vaccines?
Now, this question is a bit tricky for me, but I'll try.
Okay.
I'm going to attempt it this way. The South African model and the United Kingdom model, where I am. Here, we started in December, and the categories were the care homes, and then frontline medical staff, and then age. And they've never deviated on age, but they made one rider for comorbidities. So people with comorbidities were accommodated. So let's address comorbidities just for a second with South Africa. I did see conversations about people saying, what if you are less than 60 with comorbidities? Why is it that you're not accommodated? There was a response, I want to say, from the DDG of Health, which said we don't have those records. I might be subject to correction here, which I found interesting because a few weeks prior, Discovery was able to provide the number of people who've got comorbidities because private medical care have got the records of the people. But which made me think now, does it mean that the public health system doesn't have records of the citizens who have got these conditions? Because when Boris Johnson announced the lockdown, he was able to say 2 million people will be asked to shield. Shielding meaning stay at home for 3 months. And as I said earlier on, you will get paid. If you're working, nothing happens, you get paid. But because you've got severe medical problems, you are such at risk that they don't want you out. Those letters dropped in the post the following day, 2 million. And one of those people was a colleague of ours. So we know that they got those correspondence immediately. Now, coming back to your question again, it goes by country. If a country decides that they're going to do the age, they do the age. With us as South Africa, it was quite interesting in that this batch of teachers, even though there was a problem in Baltimore, it still continued that 300 some odd thousand was scheduled for teachers. And then I watched another briefing last week with the acting Minister of Health saying that they're doing trial runs for retail workers and defense and all of that. So you seem to think, hang on, what method are we following now? And then I spoke to someone as well who's working in a vaccination center who was saying to me, they wait. They get excited when people come in because the 60 plus are not coming as much as they're expecting them to. And he was wondering as well, why are we not taking the next category so that we can get the people vaccinated as we have the doses? Because our doses might be there now, but how long are they going to last? How's the supply going to continue when we get further down the ages? So incentives in different countries, rightful so, as you're saying, but there's one thing I've noticed here is that we didn't even get to incentives. Only yesterday, we got a text in our area that there was a bus vaccinating 18-year-olds with Pfizer with an 8-week spacing for first and second doses because of the target that Boris Johnson has said that by July, everyone must be done. So it depends on what the country is doing. And here, they've made it clear that they're going by age and comorbidities, and they've followed it, and they've not deviated one bit. Yeah. And then we have got the teachers, the defense, the police. There's one category, though, I feel should have been prioritized, which is the correctional services. You know exactly where they are. Some of them will be coming out, and they'll have missed their chance if they go according to the normal queue. So it's very easy to just rock up at the correctional services and jab the people who want to be jabbed.
Right. Whew, okay. So, Dr. Johnson, let me bring you in here, and then we're just going to get then into the basic questions around what if there's an allergic reaction, how common are side effects, how long should I wait until the next jab, and so on. We'll get into that in just a moment. But there is one thing I want to address because it is a subject. It is a cause of so much antipathy and dissatisfaction. Often in South Africa, we're hearing, bring the private sector in, let the private sector play a role. Why is the government centralizing this? Why are they controlling this? I personally think there are areas where they could kind of loosen the control. But I think let's be factual around why the private sector does not have vaccines of its own at this moment. Just talk to us about the global picture. Who's allowed to buy or to procure vaccines all over the world?
Yeah, no, I mean, that's the great question, really, because at the moment, as far as I know, it is still the case that negotiations with manufacturers are being done through national governments or through multilateral bodies like COVAX. So, so yeah, I don't think it's possible at the moment for a Discovery, for example, to go and procure their own vaccines and then distribute it to their members. So that would be difficult anyway because of that situation. And honestly, it would create situations of quite extreme inequity if that was the case, because then you'd have insured people in this country, in South Africa, getting vaccinated quite quickly, and uninsured people would be waiting. And I think nobody wants to see that happening, because that just exposes, I mean, we know that we have inequity in South Africa, high levels anyway, and that would just exacerbate that. So I don't think we want to do that. What we'd like to do is roll out vaccines as quickly as possible to as many people as we can, whether you have health insurance or not. The private sector is deeply involved in the vaccine rollout, and have been from the start. And it's been, in some ways, one of the successes. It's a model that I hope that we can learn from. There's traditionally been so much antipathy between the national department often and private sector health providers. What we've seen throughout the COVID response, in fact, is an enormous amount of cooperation between the private sector and the public sector. And as we've seen, if you go drive through Sandton and you see Discovery, the Discovery headquarters is set up as a vaccination site, that's not only for people on Discovery, and it's not only people who can pay, or for health insurance, that's a Discovery site that's open to anybody who makes a booking through EVDS. So it's a fantastic example of the private sector really coming to the party and supporting the effort. And of course, the Solidarity Fund is a good example where, many organizations as well as individuals have contributed an enormous amount, billions of rands to this response. So, I think it's a good news story. But one hopes that it can continue.
Okay, let me just read a tweet here. It says, or a comment, I beg your pardon. It says, I hear and get the criteria followed, but if we were to apply critical thinking and Pareto principles, which group of people would give us most benefit if they were vaccinated, given their activity and access to others? I think, Dr. Sangla, you have partially answered that one. Do you want to go for it? Do you want to give more detail on that?
Yes. Now, I think this question basically is saying, give it to young people. I might be mistaken, but that's what
that's also what I heard. Maybe we're just too cynical. Let's just be positive and not think too much about it.
So if this one is not saying that, then I feel that the older generation is still the right way to go, because they are more at risk. They've got comorbidities, and some of them have got much more comorbidities than others. So I think that model is the right way. Age plus comorbidities. But that is if you've got the record of the people who have fit that criteria. Because you'll find a situation whereby if you don't have that record, someone will register and mention everything under the sun, and you've got no way of proving that they've got it or not. But Reddy, can I just please jump onto what Dr. Sol was saying about the private sector, and take it a little bit further by saying, without the private sector, there will be no rollout in South Africa. They've played a huge role. That's a good thing for the private sector, but that's a terrible indictment for the government. Terrible indictment for the government, because this is what the government should be doing. The government is there for the people. We watched the presentation where there was a select number of people who were going to go and fundraise to get vaccines, which is how this program started. And Solidarity Fund has done well. They've raised the funds. But this has been an eye-opener in terms of the capabilities of the government when there's a crisis. We are not addressing the amount of money that has disappeared. We're just talking about actually doing what you were supposed to do.
Yeah. Oh, that hurts, hey? That really, really hurts. And I think very often, I do vacillate between optimism, wanting to be constructive, and then when you wake up to the ineptitude the lack of foresight and so on, it is exasperating. But enough of that for the moment. Sabelo, I'm going to read your comment because I was about to ask Dr. Boitumelo this question in particular about those manufacturers who have not applied. And I think your question relates to that. It says, I'm assuming, that's Sabelo Skite, thank you so much, Sabelo. Says, I'm assuming we are now talking vaccines. My questions to SAPRA and the doctors, I'll direct it to you, Dr. Boitumelo. How critical is it to mix our vaccines when we are purchasing as opposed to just focusing on one? Secondly, our government has been at pains to say such and such company hasn't shown interest to supply us with vaccines and therefore hasn't given us data. Can't we go and ask for data to determine if we need a particular vaccine instead of waiting for them to come to us? Waiting just seems to communicate that everything is okay and we don't need vaccines. Sabelo, thank you. That's exactly what I was going to ask Dr. Boitumelo. Why are we sitting here? Why don't we go to them and say, hey guys, we need this and here's the money, if it's there.
Yeah. No, let me talk first to the one on the mix. I think the strategy of having a mix of vaccines is indeed a good strategy, because we know that they all have different efficacy levels. And also we're dealing in an environment where there's global supply issues, and you've seen them play out, right? So you want to ensure that you've got a range of vaccines that you can access at a time. And you've seen many countries have at minimum 2 vaccines that they are rolling out. And so it's a good strategy that we should have as a country. And if we can have more, because of the global supply issues, that would be better. You've seen how a lot of the middle income and the lower income countries are just struggling to access vaccines. And
right.
So it's a good approach. In terms of asking for data, and this is where I have to say that I commend the Department of Health. I work closely with some of the colleagues. They have gone out. They've gone out and met. I mean, yesterday, personally, we were in a meeting with people from Moderna in the US. And we were talking them through what the regulatory requirements are. And they were with one of the local applicants saying, they're thinking of applying. They want to make sure that they understand the regulatory processes. So there has been those engagements. And I think the issue of global supply is a challenge. Some of them are new players. Novavax is a small pharmaceutical company. So they may not be able to supply, and maybe, Dr. Saul can speak to that. They may not be able to supply the continent, the globe, in the large numbers that a Pfizer and a Janssen can. And so some of them have made commitments either to COVAX and said, we'll make it, but it will be through COVAX. Some have said it will be through COVAX and it will be through bilateral arrangements. So, the country they really have, but it's about supplying. But I'll talk to manufacturing issues later. Hopefully I'll have the time to talk to that.
Okay, Dr. Johnson, is there anything you want to add to that?
I do want to make the point, because sometimes it gets lost in all the detail, that, this is a phenomenal effort to get these vaccines. For those of us who worked in HIV for a long time and have been waiting, 30 years to see if we can develop an HIV vaccine. I looked at this and I thought, we're not going to have vaccines for another 2 years for COVID, because it's, we're going to get some, they're not going to be effective. And what we've seen is the development, rapid development, and this came off the back of a lot of science that happened already, right? So this didn't just happen from scratch. People were already working on coronavirus vaccines because we had seen coronavirus outbreaks. So, there was a real worry that this was going to happen. So people have been working, but, with a lot of effort, scientific effort, a lot of funding, we were able to develop this basket of vaccines. That is phenomenal. And these vaccines have now been rolled out all over the world and have shown to be remarkably safe and effective. Actually, really incredible, because and the safety issues that have come out, for example, the clotting, the rare clotting events, which they are very rare, but they are there. Now we're hearing some reports of heart inflammation in some young people. Those, again, very rare, but they do seem to come out. That shows that the system works. That shows that we are monitoring these vaccines. We're picking up, because we are vaccinating tens of millions of people, hundreds of millions of people. These are overwhelmingly safe. We are picking up some rare side effects. So, you know, the message has to be go out there. These are fantastic medical products. If you can get one, if you can get yourself in a position to have one, you have to go and try and make that effort, because they
Let me challenge you on one thing, Dr. Johnson. You're sounding a bit too sanguine, a bit too optimistic for my liking, you know, because you're saying we have developed vaccines. We have, who's we? Are we not basking in the glory of investments that other people in other countries have been? I know we've got world-class scientists, and I've always asked this, that we've discovered this, the first heart transplant, the first penile transplant, the different variants and sequencing, it started here. Nobody else was doing it at industrial level like South Africa and the UK. And then we got labeled for our advances as well. But when it comes to vaccine development, I know that we've got BioVac. There have been some exchanges with Sanofi Pasteur when it comes to Sanofi Pasteur, I mixed it up. When it comes to a one-time, all-in-one pediatric drug, that was a new announcement last year. And recently we've seen those bilateral relations between Mr. Ramaphosa, between South Africa and France, yielding some results. But come on, are we not kind of punching below our weight, that we could be doing more? We are a middle income country. We have the expertise. So why on earth do we not have the manufacturing capacity that we need to respond to the magnitude of the problem?
Look, it'd be fantastic to have vaccine manufacturing capacity, you know, on our soil. It's not straightforward. These are complicated processes. Dr. Botumelo can attest to that probably better than I can. It's not making toothpaste, you know. These are, if you talk about mRNA vaccines, these are really complex things to produce. We should be able to do it. I would hope we have the scientists to do it, but it would take a big investment and effort. And the one absolutely horrible feeling is to feel like we're at the mercy of a global supply chain. Absolutely. But I think at a global level, this is a phenomenal thing that's happened. And why I'm saying that is because we've got, let's say, 5 million people over 60 in this country, and only about half of those people have registered to have the vaccine. So where are the other half? And we have enough vaccines for those people. We have enough vaccines. We have the supply now.
Well, maybe they don't have data and they don't have gadgets. They don't have, you know, because that's another thing that really got on my nerves. It got on my nerves because how are you saying people must register on EVDS? Our grannies don't even know how to, you know, 8 out of the elderly people that I took for their vaccines recently, they'd all deleted the SMSs, not the appointment SMSs, they never received them, but that registration one, they'd all deleted it, the ones who had cell phone. And the other one told me, I'm phoning telecom. You know, like I don't have a cell phone. You tell Zolim Kiza to call me on my telecom line. It was hysterical. But just very quickly, the fact that our solutions must respond to the reality in our country, right?
Really, if I may come in,
anybody can come in on that one, but
okay, Dr.
we've all been there.
Dr. Vitumelo. And I'm going to bring in Denosa in a moment. Yes, Dr. Vitumelo.
To the manufacturing one, and you know, I think we have all the elements. The thing is, the elements aren't working together. The mRNA technology, a lot of scientists in the country, we can make that. We can make it simply. There are mechanisms to scale up mRNA, and that's why the hub focused firstly on the mRNA technology, because out of all of the platform technology, it's one of the easiest. So we've got pockets of this. They're just not integrated. We're not working together. And even with the little funding we have, it then is not coordinated. So a coordinated strategy that brings all of these elements together is what we need. And I really hope that we've learned from this and you know, through this hub and other mechanisms, we would be able to manufacture, but it is doable. We've got the elements, we've got the scientists that have the know-how. We have to invest also in the skills to manufacture.
Okay, Simpiwe Gata, can you hear me? Simpiwe from Denosa? Can you hear me? Maybe unmute yourself. Let's see if we can get a word in from you. I really want to know how nurses are seeing this and experiencing this. Let's try one last time. We know that technology is quite challenging. Simpiwe, are you able to unmute yourself and talk to me? Going, gone. Okay, Simpiwe, maybe we'll just...
Sorry, Reddy, while it's gone, sorry. Okay, just want to go back on one of the points that we mentioned in terms of, I think it was Sabelo's question.
Yes.
In terms of putting all the eggs in one basket. And that question about going out to manufacturers, I hope he's going to stop hounding me about it now, because he's been asking me that for weeks now. So he's got his answer. Now, we had a shipment of 30 million doses. And the Baltimore situation happened.
Yes.
Now, we placed that order with one manufacturer. And as Dr. Tumelo was saying just now, it's prudent, it helps to have more than one. At the moment, the UK has got 4. Johnson & Johnson is going to be registered later, but there's 3 going, and they've gone for the 4th one. And we went for 1, and then we've added a 2nd one. The other ones are still in the process, as Dr. Tumelo was saying, but a decision was taken that we should place 30 million on this one. And unfortunately, life happened, and here we are.
I just want to comment here from Dr. Melusi. Says, I'm in the webinar. Thank you. Welcome. I particularly liked how Dr. Vitumelo broke down the process of registering of medicines for use in South Africa and why the process needs to be followed. Also, how we've tweaked the process to fast track the use of vaccines. Informative. Really love your feedback. Okay, you know what? We can get into the conversations around lack of access and the logistics and so on. I suspect some of our participants and viewers will take us back to that one. But I really want to accommodate people who are sitting there saying, of course, I want the vaccine when it's available for me, or I want it, but I've got questions, I've got unresolved issues. I also want to address things that can erode trust in vaccines themselves. I'm going to start with one, and I'm not sure to whom I'm directing this, but any one of you, it's so nice to have 3 doctors because any one of you can answer it. Let me just ask this particular question. Many times we hear that even the scientists are not knowledgeable. They keep flip-flopping. So I'm asking you a question. Can you insist that science remains the most credible process to determine efficacy of treatment and vaccines, and actually to monitor the virus itself? Here's the context to my question. Every time new evidence emerges on a drug or on the virus itself, there seems to be some controversy and criticism of your profession that you are flip-flopping. We know that Dr. Fauci has been on podcasts and everywhere trying to not necessarily clear his name, but to explain this, in simple terms. He's been attacked for continuously adapting his positions. But is that what science is supposed to do? Maybe the rest of us don't understand science. We put our hopes in you. We want it to be certain. What does it mean when you shift your position as scientists? Is that part of the game? Who wants to answer that?
I'll take it.
Okay.
Now, when we go to medical school, there's a curriculum in all the different disciplines. You open a textbook. Here, we're dealing with a condition that's not in the textbook. So from when it started, we were learning. We are still learning today. So what we knew in March last year has changed and evolved. Remember when we started, we were talking temperature, all of this, and then there was a discussion about airborne, not airborne, droplet. Everything about this is new. So when there's new evidence, we bring it forward. Those scientists bring it forward. We adapt to it. We go ahead with it. We were fighting here with Public Health England in the beginning, saying that we shouldn't be wearing masks. We shouldn't be doing this. It's too early. And then all of a sudden, there's a new directive. What was happening yesterday doesn't happen today. It's a new disease. We are learning as we go. Today, only yesterday, now we've got Delta Plus variant, not Delta, Delta Plus. Yeah. So everything that is happening and the decisions being made are made based on the evidence that is available at the time. So if you don't deal with the evidence, you say, no, last week you said this to me, I'm not changing. That's not how science works.
Yeah.
You evolve with the evidence that you've got.
And I suppose herein, of course, we all have different perspectives. I mean, herein, for me at least, lies the credibility that the only problem is a person or an institution that never changes its mind. This is where we stood with the information we had at the time. More information has come, or this thing has evolved. Here's the new information. It's not a contradiction. It's not flip-flopping. It is, I think, edifying ourselves and beefing up our knowledge, as it were. The next question related to the one that I've just asked, and either you, Dr. Widumelo, or Dr. Johnson can take this. Let's go to the J&J vaccine. And I know that this kind of truncated our progress when it came to rolling out vaccines. We had our hopes on the J&J vaccine. They were contaminated. What I see is people believing that this happened at the Aspen plant. It happened here. Baltimore is seldom mentioned when we talk about this. And even if it is, we can't have a one-upmanship here that it's them versus us and so on. But my question is this: please explain as simply as you possibly can what happened with the Baltimore situation and why discarding those contaminated vaccines was important. Because for me, I want to respect the person who sees it differently. This is how I see it. For me, it kind of validates my belief in science, that the fact that this was picked up and the fact that these vaccines were discarded gives me more confidence that the vaccine that will end up in my arm is the right one. Or am I being too kumbaya, lovey-dovey type of thing?
I'm glad you feel that way, because that for me is what we want this to communicate, that even with the pandemic and the pressure that we're under, we could have easily said, it's a pandemic, we need these vaccines, let's release them. But even with that, we said, no, the safety of the public is paramount. We're not going to compromise the safety. If I can just briefly talk to what happened. So when you manufacture a drug, you've got what we call the active. So this is the part of the product that actually does what it's supposed to. Then there's other things that make it into a formulation, whether a capsule, a tablet, in this case, injectables. So with the J&J vaccine, the active, in this case, was manufactured at the Baltimore site. They would then ship the active to South Africa for Aspen to formulate it, do the fill and finish. Part of it was for South Africa, the 2 million doses. The rest was going to go to Europe. Now, it came to our attention because you have to test every single batch. That when they tested one of the batches, they found that there was a contamination with the AstraZeneca vaccine, because there was a point when this facility was manufacturing both the J&J and the Aspen. So because probably they were overwhelmed, again, this is a pandemic, global supply under pressure. They were overwhelmed. There's some processes in the manufacturing process that were compromised that led to the contamination. We then said, if you can contaminate one batch, we're worried about all the batches then, because then what else are we missing? That's when the FDA, and it had to be the FDA because they operate in the US jurisdiction again. The FDA had to go inspect the facility, look at all the records, look at when every single batch was manufactured. And after looking at all of the records, they picked up non-compliances. And there is a report available on the website of the FDA, and very serious non-compliances. And based on that, we then said the certain number of batches, we now know that they were manufactured when the facility was not complying with good manufacturing practices. And what good manufacturing practice is, it means that you bring in your starting material through this door. You take it out through another. You don't bring waste through that same door. When people flow, they must gown properly. When they leave, they must shower. All of those things. So there's very, very clear processes. And the minute you compromise on all of those, you're compromising the product. So that's why we had to then say we're not releasing that. We inspected ourselves as SAPRA, the Aspen facility, and the FDA relied on our decision on that site, as well as Europe, to say Aspen meets all the requirements. So the Aspen site is not questionable at all. We're confident. They meet GMP standards. They've got the GMP certificate. The European regulator has relied on our data. They're happy with that. So has the US. The issue is not at the Aspen facility. The issue was with the active manufactured in Baltimore.
I think I want to say this again. The issue, my loving friends, especially on social media, was not at Aspen. It was elsewhere. And all these safeguards just demonstrate a kind of pedantic process. and it inspires a different position on my part. I respect yours. But for me, if those vaccines were just used and were kept in the dark, that would have really gotten under my skin. But the fact that a distinction was made between what ought to have happened and what actually happened, and then a decision was made, I wonder whether I could invite you to see that as something positive. Here's something else, Dr. Johnson, that I want to ask you in keeping with this flip-flopping theme by you scientists. So our elderly people have gone for their Pfizer vaccines. They were told to come back, I think, after 21 days. Now they must come back after 42 days. And in some instances, not in South Africa, but elsewhere, the Pfizer dosing interval, I read, has doubled. And that public health policy went ahead of science, that it was a shot in the dark that basically just paid off. Canada, the UK, and South Africa following suit and doubling the interval between the first and second dose of the Pfizer vaccine from 21 days to 42 days. So here's the thing. It's very easy for someone to say, they said I must come back in 21 days. Now it's 42 days. I don't trust these people. Or they don't have enough vaccines. That's why they are extending the interval. Fact or fiction? Why has the interval been doubled?
Look, I think part of it is to make sure that we give the first dose to as many people as possible. Because we know that the first dose actually does protect people. It's not as good as 2 doses, but the first dose does give people some protection. And we're trying to target the over 60s in a third wave, when we know those are the people who are at such high risk of dying or severe disease. So, that is the case. But does it work? Well, it in fact has been shown that that if you wait longer, you get a much more vigorous immune response. So actually, it turns out that it's good science. It's both good public health policy, because we want to vaccinate as many people as possible and get the first dose into as many people as possible. But it also happens to be good science because you get a better immune response if you wait that few extra weeks. So, this is a good occasion where both of those things coincide.
Okay, so
again, it's a question of, we don't have all the answers in the beginning. The evidence emerges as we go along because the longer we carry on, the more we find out both about the virus and about the vaccines and how best they work. For example, can we mix and match vaccines? It's a really valid question, and we don't know the answer to that. That hasn't been fully decided. But there are lots of places who are doing studies trying to answer that question.
Yeah. So you see, that's why I wanted you to answer it, and so that it doesn't look like I'm just throwing stuff out there that I've just made up. Because I also was when I first heard that, I thought, oh, now we've got a shortage. You're extending the time. I did. I must confess. And then reading up a little bit more.
Can I jump in there already?
Yeah, sure. Let me just finish this point, that the study finding that people who got their jabs a couple of weeks apart had more than triple as many antibodies in their blood than those who were immunized 3 weeks apart. That surprised me, I must be honest. Dr. Sangla, over to you.
Now, this is where the flip-flopping comes in again, because that happened to us when we started getting vaccinated, and I was vociferously against it because I wanted my dose at the time that Pfizer dictates that I should have it.
And this is in the UK, right, Dr.
This is in the UK, yes. So, but the reason that was put forward was that we need to get to as many people as possible. And as Dr. Johnson is saying, so that they can at least be protected. It was only accidental that it was discovered that you get more if you extend the period. But coming back to the point you're raising, I was watching that vaccine briefing. The mistake that the government made was not to take the decision immediately, because I remember the minister saying, we will communicate and we might do what the UK did. But now the downside of that is that people got SMSs for 21 days.
Right.
And then later it was changed to 42. So if that decision had been communicated immediately, that would have done away with that.
Dr. Widimelo, okay, so what if somebody is saying, here you are as scientists, saying that when evidence changes, when new data comes in, we then adapt our position. It makes logical sense, not just, it's the obvious thing to do. But what if somebody's watching us today and saying, they keep changing and changing, and how long does immunity last from vaccines? And if there are so many variants now, why should I get vaccinated now? Why shouldn't I wait? Maybe let me just wait. What would you say to someone like that?
Yeah, I mean, I think it's important that we get vaccinated. You know, the pandemic has had a dire impact on people's lives, on the economy. The socioeconomic impact of this pandemic is heartbreaking. Yeah. And here is an opportunity for us to do something about it. And we're not saying you will not get infected. We're already seeing that, right? There are what we call breakthrough infections. And actually, we're working with some of the scientific community to develop a protocol to study those. So you may get infected, but you will not be as sick as you typically would have been. So I would still recommend that if you can, do go get the vaccine. We need to open up the economy. You heard what Dr. Sangna said about the UK economy. People are able to now gather. People are able to now go to work. We have to ensure that we get to some level of economic activity. The impact is too dire. And as you said, really, it's about also protecting the next person.
Okay, Dr. Widumela, I have we thought we'd avoid mention of certain people because I thought you so eloquently took us through the process, and yet so diplomatically. I would have been a bit more strident if I were you. But here is Dr. Maria, who's saying, SAPRA, please enlighten the persons who are planning to march on your office this Friday that you are not refusing to register the vaccines. There is no need for persons to put themselves and others at risk for COVID-19 infection by marching based on incorrect info. The third wave in Gauteng is ravaging. No need for unnecessary risk-taking. That is from Dr. Maria, and I guess she knows what she's talking about. Dr. Widumela, any comment?
Yeah, I mean, I would say, you know, we are indeed in a third pandemic, and while it is our right as citizens to march, we must be cognizant of the pandemic we're under, the lockdown regulations, you know, the impact that gatherings are super spreader events. So that's a comment I would make. I also saw someone say, what's our view? Are we scared? I'm not scared. There's nothing to be scared about. I do my job with integrity, and we're not going to be influenced or swayed by anyone or anything besides science. Science is the only thing that sways us. And you know, if we give in to any, whether it's a political party or even the public or even the medical community, if we give in to any influence from them, you will not trust us as a regulator. Many of you have seen the stories around ivermectin. Had we given in on ivermectin and not stood our ground, and we still continue to stand our ground until we get data, we will not change our position. Similarly with these vaccines, until we satisfy ourselves as a regulator, we will not bow down to any pressure. So yes, there will be marching on Friday. I will be there. I'll receive the memorandum, and we will take it from there. And I'll go back to the office and I'll work with my team and we review the data. It continues. And so that's our view really on these matters.
I must say, I mean, I know I'm the moderator here, but I'm also a journalist, and there is a way in which I also get frustrated with the question, what is news? And I say this with humility because we all evolve, we all grow. Maybe when I was 22 and I was young in my career, I also would cover everything that happens under the sun. But I think because we find ourselves in this very critical moment of life and death matters, I think anyone who's covering that march, by all means, but don't mute the voice of science, because if we're going to say this party says SAPRA must register, this party says SAPRA is refusing, they say, then I think we are doing a disservice to the public if we don't counter that with the real information, the true information that yes, that's what they say, they are marching, they demand this, but this is how the process works. This is why Moderna is not here. The Moderna US, they've not applied. Sinopharm, the application has only just come through. That's China. Sputnik, it doesn't matter whether Russia is your comrade or you love Vladimir Putin or not. That's not the issue. The issue is the adenovirus, it uses similar to one used in an HIV vaccine trial. Because if SAPRA were to just approve it and these adverse effects are found, you'll be the first ones to march again and saying that they're using our people as guinea pigs. So just make up your minds. And I think that this is a time for such important edu journalism and to actually take a stand around what we cover and how we cover it. Okay, so Dr. Sangma, if someone has had the vaccine, whether it's the Johnson & Johnson vaccine or the Pfizer vaccine, let's say 2 doses of the Pfizer vaccine, and you feel that you are comfortable and you are protected, does that mean I can discard my mask? Can I go to a nightclub? Can I just go on to the way my life was before the COVID-19? I mean, why am I wearing a mask if I've had my doses of the Pfizer vaccine or the J&J?
Now, nice question. There has been talk in America about discarding the mask. And one thing we need to be aware of with this, I think we touched on this earlier on, is that as long as COVID is with us, there are things that are not going to change. And we need to be able to modify our behavior as such. Now, you mentioned nightclub. Nightclubs shouldn't be open. So if you've got your 2 doses, you still shouldn't be able to go to a nightclub in the South African context, because you are in the midst of the 3rd wave. The vaccination process has only just started. So that is a non-starter to begin with. The issues that we are grappling with at the moment will still remain even though you've got 2 doses, because as Dr. Buitumelo has touched on before, you will still get infected. But what the vaccines are doing, they're trying to prevent you from being severely ill, being hospitalized, and dying. So your infection will then be mild than it would if you didn't have the vaccine. Now, this is something that unfortunately is difficult to say and difficult to spread and difficult for people to understand, because I think we're conflating vaccine and cure.
Right.
So the vaccine, all it does is it prevents you from being debilitated by the disease, something called morbidity and mortality. You will still get infected. So still isolate. So the social gatherings avoid, wear a mask, wash your hands, use sanitizer, as long as we are in a pandemic. Now, the other countries have started talking about that. Even here, I think in the UK, there's a date that's been mentioned for when we're going to teach masks. I am not going to teach mine. I am not going to go to Old Trafford, even though we're allowed to go. I will wait, because as citizens, we need to be able to go beyond what the countries say we should do, because it is about us. And I think you touched on this in your opening about unity in action. What you do, what the next person does, what another person does affects everyone in the world, as long as we are in a pandemic. So you've been to Eshibin, you've been to Konka, I'm sorry, I'm going to mention it. You've been everywhere, I've seen it. The question is why during a pandemic?
Phew, yeah, why? And, you know, I can't help at this point to think about all the people we've lost, And I know that I'm not the only one. I know that many of you have lost your cousins, your parents, your children, your friends. We're watching their funerals on TV. Jabu Mabuza was buried today. Peter Matlari, I've lost 2 cousins a couple of days apart in January. My mother, her close friend, the first person to die in South Africa without comorbidities last year, 11th of April, was my husband's cousin, early 50s, no comorbidities. And that's what happened. And we're not the only one. I know that. And so I think that it does fascinate me about human behavior, that sometimes what does it take? Because for me, the finality of death, that we can't bring those people back. So to sit with my mask for a little while longer when compared to losing people permanently seems like such a small price to pay for me. And I hope that there are so many of us who are reflecting in that particular way until it is safe to do so. Dr. Johnson, let me bring you in here, because I did have a question around the anti-vax movement. You know, I always thought that it was big in the US and elsewhere. I assumed, without any data, I must be honest, that we had a very rich vaccination culture in South Africa. And I based that on the township of my birth, that the clinics were full of mothers queuing, even in the dead of winter, to come and vaccinate their babies. I used to take some people to the Alex Clinic, and people were adhering, bringing their babies. So I suppose in my mind it was, this is something that's familiar. We've been doing this without any conspiracies. And so I blame Donald Trump and the anti-vaxxer movement for how we've kind of inherited the madness from across the Atlantic. But anyway, let's just be factual here. That I wonder whether in South Africa, are we dealing with anti-vaxxers or vaccine hesitancy, which for me is conceptually different, distinct from anti-vaxxer. I add to this question a question here. Has there been any investigation, Dr. Melisi asks again, has there been any investigation into how vaccine hesitancy contributed to the numbers of people who registered for the shots? If so, what has been identified as a major contributing factor and what is being done about it? A loaded question, answer what you can. Dr. Johnson?
So I think there's a spectrum, really. I think that we have anti-vaxxers in South Africa, like they are worldwide. Unfortunately, it is a worldwide phenomenon. I don't think it's that common in South Africa. I mean, I think it's very common on social media, probably, where people have a very loud voice. But I think when we look at the surveys, it's less than 10% of people would say, I will never get vaccinated because I don't believe in vaccines. But then there are another maybe 25% of people who we might call vaccine hesitant, who have got questions or concerns. They're worried about side effects. They're worried about efficacy. They ask the same questions. How have these vaccines been developed so quickly? Have they gone through all the rigorous processes? I got into an unfortunate Twitter fight a week or so ago with somebody who was absolutely insistent that they haven't gone through phase 3 trials, that there haven't been phase 3 trials, and so these vaccines haven't been properly tested. And no matter what I said to this person, I could not convince them that these vaccines have gone through a rigorous process of testing. So I think what we have to do, I don't think that I think as really you said, I think the people who haven't registered, I don't think it's necessarily because they're anti-vaxxers. I think it's a range of reasons, and because it's the over 60 population, a lot of it is we've created a barrier by making people register on EVDS. It's made it hard, and now we have to overcome that barrier. But I do think we're quite involved with trying to put out messages to address some of those myths and misconceptions and address that. I think we have to be patient and compassionate with people's concerns. Yes, there are those anti-vaxxers. It's hard to reason with those people, but I think a lot of people who have genuine queries, I think we must take the time to explain to them and trying to address their questions in an open and honest way to the best of our abilities.
Anybody want to add on that? Because I think it's important, the hesitancy, the anti-vaxxer, how we design our message, how we engage such people. You guys are doctors. I'm sure you've had people coming to your practices or to your wards teaching you medicine when you are the ones who are qualified.
Now I can jump in on that.
Yeah.
Now, the column you spoke about, that's why I wrote it, because of exactly that point, which is why I started from a young baby. Because a vaccination schedule, as you've said, with the mothers queuing, everyone does that without a second thought. And they go through it up until age 14 or whatever the last one is, and they go through all the children get the booster shots, and everything is there, and there's no question. And then when you register in school, you produce your vaccination card. And then I went further to address travel, because people go to different countries, different continents, and they have to apply for a visa. And one of the requirements in your visa, depending on which country you go to, is a vaccination. Yes. But now, a friend of mine said the word vaccination might be an issue. It's a shot. So they say, have you taken the shot before you go traveling? So maybe we are not putting them together in terms of this vaccination is the same thing that you do for your children. We've all got BCG scars. It's the same thing that you take when you're traveling. And as doctors, when you register, when you're applying for a job, you have to get your hepatitis, because if you don't work in the surgical rotation. So everything that you need to do, you comply with it. But this one has been quite tricky, because we then need to define, as we were saying, are these anti-vaxxers period, or is it doubt about this particular one, which then becomes a difficult one in that this disease is decimating the population. But this is the one vaccine that we are struggling to get people to get on board with. Even though the percentages Dr. Sol is mentioning 10, 20, but we need as many people vaccinated as possible so that we can start to have a semblance of life as we used to know it in 2019. It is crucial. And in terms of the side effects, yes, side effects are there. Dr. Boitutuma has touched on it. The regulators look at everything and they weigh the benefits is it safer to vaccinate than not? We had the big issue about the clots.
Yes.
But now when you go to the oral contraceptive pill, and then people say, oh, okay, because the numbers of clots you're getting from the vaccines, and you compare them to the oral contraceptive pill, and you compare the side effects to all the other medications, and you weigh the two, it is still safer to get the COVID vaccine because it is going to save your life.
Dr. Boitumelo, just on that, I think a whole lot of us had, have relatives with comorbidities and so on. And I have shared publicly, my mom had a brain tumor about 2 years ago, successfully operated, she's fine. And so when I registered her, I was excited. I'm like, Marco, registering. It's like, hey, Emma Billy, I need to check with my neurologist because clotting and stuff. And she checked and they said, go for it. So she had her first dose. So I'm just saying that we recognize that people, there's cancer in families, there's TB, there's all sorts of things. For those people who are genuinely scared, and we have acknowledged here this evening that there isn't enough data, what do you say to those people? And is there a way in which we can have some platform where those issues are responded to and people can get answers?
No, thank you. I mean, it is a real concern, particularly with the elderly, issues of the side effects and what this could mean. And so what we've done is there's a mechanism in place, and most of it is digital, which is unfortunate. We're looking at a more manual process to say, how do we go out and proactively solicit some of these side effects, especially from the elderly? But there's a mechanism that they can report. And we're working, with the Department of Health, the directorate that looks at these infant vaccines to say, how do we ensure that we get back to people? Because we're getting a lot of reports. We're actually inundated with some of the reports on what we call adverse effects following immunization. And it's good that people can report. But I would still say, the benefit of getting a vaccine still outweighs the risk. We've even had questions around pregnant women who have said, should they take a vaccine or not? And I can't say this word always, the Obstetrics Society, they've also issued an opinion to say, because COVID also, it leads to these vasculature diseases, and the clinicians in the forum can say, the risk of you getting such from COVID itself is higher than you getting some of these effects from taking the vaccine. So the benefit of taking the vaccine still outweighs the risk, indeed. And you have to monitor it. You have to work with your medical practitioner, get advice from them. Before you take it, go talk to them and say, should I take it? Have regular checkups, etc. So that's what I would say.
Yeah. I can't look. You know what? Now I'm there. As soon as I get an SMS, I'm there. No doubt about it. But I certainly do want for people to be heard and for their questions to be addressed. I think more than anything for me here, it is the mask, continued use of mask, to think not just from an individual point of view, but to think collectively about what tomorrow might look like if we just bear it a little bit, if we just hang in there. We've been through so much together. We've been through so much already. So I think a couple of more months. That doesn't mean we must sugarcoat the issues. And I'm so glad, Dr. Sangla, you were more strident with the criticisms, and those criticisms are valid and they frustrate me as well. We're wrapping up. We're running out of time. But let me start with you, Dr. Johnson. What would you like to see happening right now, and how would you like society to respond now to the vaccine question? Very quickly, Dr. Johnson.
Yeah, so again, I just urge everybody to go to register as soon as you can for the vaccine. I do believe that we're going to see much more supply coming in over the next month into the country from various mechanisms. And so I think we'll start to see much more supply, and it would be a tragedy if there wasn't really vigorous uptake of the vaccine.
Mm-hmm. Okay, Dr. Widumelo, your final thoughts and words?
Being a regulator, I want to say to the public, you need to have confidence in us. And I think that what we demonstrated with the J&J vaccine indicates that we will make sure that the safety of the public is paramount, besides any other factor. So, trust us in this, and we will focus on science and ensure that we authorize safe vaccines for the country.
Dr. Sangla?
Thank you very much for this platform. And you have addressed something, and Denosa unfortunately couldn't get on board, but I can say on the wards, the situation is terrible wherever you are, in which hospital you are in. People were dying alone. You had to speak to families on the phone to tell them that there's nothing that you can do, and you've gone as far as you can, and they couldn't visit, and it was stressful. I'm speaking the past tense because it is better now here, but unfortunately there you're on the third wave. So it is very important that resources are used the right way.
Yeah.
Testing is paramount, but I've seen that testing is still not being done as much as it should. People are having flu-like symptoms, but saying it's just a flu and continuing with their lives. And medical aids, as far as I can recall, we're paying for one test and then they'll pay if it's positive. I don't know what happens if it's negative, but you need to be tested as often as you get the symptoms or as you feel as if you need one. And here there is also asymptomatic testing. The lateral flows that you're paying for at the private facilities over there, citizens here are getting them for free, and they're testing twice a week to make sure asymptomatic, that there's nothing going on. And then if you need a test, the government website, you register, you go for a test, and it's all free. Hence, I said 1 million tests yesterday, 40,000 tests in South Africa. That is the gold standard. Test, trace, isolate. If you don't do that, you are still going to be in this for a long time.
I just want to conclude with a WhatsApp that I've just received. A neighbor of mine, Karen, has sent me a WhatsApp, says, I think the best way to get anti-vaxxers is to tell them they are not allowed the vaccine. So many people object for the sake of objecting. They don't think that they are fighting a virus. They don't think they are fighting a virus. They're not basically, they think they're fighting a government decision rather than a virus. I mean, anyone knows I'm very, very critical of so many aspects of government implementation in particular. And there is no way that we would come here and not want to question the government. The virus has nothing to do with the government. Yes, health infrastructure, the way they respond, all of that is important. But think of this as a test of your own agency, a test of your own citizenhood, if there is such a word, a test of your decision about where you want the country to be in the next couple of months. And I understand, guys, you keep saying, stop telling us about vaccines, give us the vaccines. That excites me when you say that, because it means you want the vaccines. And don't stop saying that. Don't stop putting pressure on government to get the vaccine. But areas of our lives that we are in control of at the moment, non-pharmaceutical interventions, washing our hands, masking, staying away, socially distanced, stay with people in your household. It feels to me to be a small price to pay. The losses have been so profound. This third wave is here. There's nothing we can do about it. But let's do what we can to mitigate. And that is doing the things that Dr. Sangma, Dr. Widumelo, and Dr. Johnson have been talking about while we wait for our vaccines. Let's educate ourselves. Let's keep the dialogue going. Thank you to the Solidarity Fund for making this possible. We hope that we can gather again under a different topic with other panelists, although I love the panelists that I have today. If they are available, they can join us again. Dr. Saul Johnson from Solidarity Fund advisor, Dr. Widumelo Sumete, SAPRA, good luck with that, your visitors on Friday. And Dr. Sangma Rosani, take good care of yourself. You've been so generous with your time, your expertise, your goodwill, and everything. I really have loved chatting to you. Thanks indeed. Bye-bye. And the people who registered for this webinar, you used your data, you stayed away from your television, you came here together in a conversation. I'm always grateful, because without an audience, without participants sending you questions, there's no meaning to all of this. So I thank you, and I care for you, and I want you to be safe. Thank you. Bye-bye, everyone.
Thank you.
Bye.